So today's episode is actually the first of a two-part episode on the differences between German and American healthcare and why the hell Americans are so determined to keep their broken system. Hello, Lieblings. I'm Madi, science fiction and fantasy author who's been living in southern Germany since 2014. As I mentioned before, today is the first of a two-part episode on German and American healthcare system, as well as my personal hot take on why Americans have been clinging to their old system for so long. I originally had planned to make this one really long episode, but I decided not to torture you guys because I love ya and decided to split it into two. But before we get started, please hit the subscribe button and ring the bell if you haven't already. Here on Adventures of Lamadi, we talk about writing, living abroad, and really everything in between. So I have seen a lot of videos that either tackle what is the German healthcare system or what is the American healthcare system, but not necessarily comparing the two. And I have seen even fewer photos, or like none at all, that actually talks about why would Americans cling to their system, especially in this time of the, of COVID-19. We're really seeing the fallacy, like the flaws, the really glaring flaws of the American healthcare system. The whole world is seeing this. America, the whole world is seeing this. And of course, I have been asked this question by a lot of my other subscribers. They want to know what I think, and I will tell you that will actually be in the next episode. Sorry guys, because it's a lot to unpack, and I want to make sure I give the video justice and not just like very quickly run through it just to, encapsulate everything in one episide. Thus, two. If you hear other random noises, it's because I have Roxy in my lap right now. Yeah, so she's making lots of noises, and my microphone's like right here, so she can. If you hear, that's Roxy. Sorry. So for this episode, we're going to talk about what are the similarities and differences to make sure that when we get into the whole deep dive of the why on the overall American mentality with their own healthcare system, you kind of understand where I'm coming from. So, of course, in today's political climate in the United States, because we're coming up on our 2020 election in November, for a while, especially with the Democratic candidates, you heard a lot of, the big fight of what we're going to do. Obviously, our healthcare system is flawed. We've tried Obamacare. There have been some really good things with Obamacare. There have been not so great things. Unfortunately, it was a problem of too many cooks in the kitchen. Too many people kind of got their fingers on it. And we have this super complicated system. In some ways it's better than what we had, in some ways it's not necessarily. So obviously, it is a step in the right direction in that we need to change. But right now the conversation, especially in political circles, seems to be to what? Do we just keep what we have, which is a combination of private and socialized healthcare? Or do we just go Medicare for all, which is completely socialized, like in countries, I think Canada's that way. I definitely know in Great Britain it is the same. In the UK, it is the NHS. So, but you know what? There are other options, our politicians have a tendency to oversimplify things, and it's either one or the other. When there are plenty, if you look at how other countries work, how they've managed to make it work. And Germany is a great example. Germany actually on paper looks very similar, has a very similar healthcare system as the United States. Obviously, it works better, and I'll get into the why of that. But there are other options out there, but I only ever hear people yelling like, and it's part of the reason why I wanted to do this episode, because I have a lot of American audience members, and to see, let's look how Germany does their healthcare system and then compare it to what Americans do, and you can see where there's some room for improvement. Some. So let's get started. So when I mean that they are very similar on paper, it's the fact that Germany and the US mainly supply their insurance through privately owned companies. And by privately owned, I mean they're not owned by the government. But the United States, a lot of those insurance companies have, stockholders, and, they're publicly owned, so to speak. And so there's some kind of, essentially, it's for profit. While with Germany, there are plenty of private. It's completely private, but they're not for profit. That's literally like the biggest thing. Oh, you know what? The video's over. That's pretty much the big difference. Thanks for coming. No, I'm kidding. There's more, but that is literally one of the big difference. Yes, you have, you have the idea of choice. I say the idea of choice because in the US, a lot of politicians have also talked about, the reason why we want to keep our current system because we want the private choice, like the private insurance companies, and not just have one blanket and lose our private insurance. The problem is, though, in my experience when I lived in the States, I didn't actually get to choose my healthcare provider. I didn't get to choose what my insurance was. My employer did. Because in the States, your insurance is based on your employer. You only get health insurance when you have a job because your job provides health insurance. Unless you're Walmart and they don't because they, work around it. But as opposed to Germany where everybody, you personally go, you pick the company you want, and it doesn't matter what your job is or where you work, you just take the insurance with you. And that is one of the big flaws that we're seeing right now with COVID-19 because so many people in the United States, I think at this point, unemployment is about 16 million Americans. Every single one of them, if they had health insurance through their job, they lost it. They lost their health insurance unless they somehow had private health insurance. Chances are they didn't because private health insurance is rather expensive in the United States. I think it's very complicated. I'd have to my mom actually helps enroll people in finding the best program for them. And so she would know better, but I know some people can afford it. Most can't. We're going to get into that. So one of the big differences is that in Germany, you are required to have health insurance. The penalty for that is that if you don't have health insurance, unless it is acute pain, life-threatening, or pregnancy-related, you have to pay for it. It's still, I'm not going to lie, guys, it's still cheaper than the US a lot of times, even with health insurance. So that's a problem, America. But that is your penalty. In the US, we did try that. That was one of the things with the Affordable Care Act was to make sure that everybody was insured by having a tax-related penalty that you would have to pay if you didn't have health insurance. And the problem with that was for a lot of people, because like I had said earlier, it's rather complicated how much you have to pay because it's based on a million different factors. And for a lot of people, and some even close friends of mine, it was actually cheaper to just pay the penalty than to have health insurance. So they just opted to not have health insurance. So that was one of the first things that Trump did get rid of. But as a result, then now we have a large number of Americans who are not insured or worse, underinsured, which means they have insurance, but it doesn't really cover shit. Also, German companies cannot legally turn you away. If you apply, you want them as your, this insurance company as your own, then they are required to take you in. They cannot say no. The US is like that now, but there was a time before the Affordable Care Act where we had this horrid thing called pre-existing conditions, which essentially, if you had something like cancer or acne or pregnancy, which I'm not lying, these were all considered pre-existing conditions, the insurance company has a right to deny you, which is just awful. So that was one thing that was like I said, with the Affordable Care Act, there were some aspects of it that were good, and that was the top of the food chain, amazing thing. It's one of those things. As much as any politician's trying to change or get rid of or whatever with the Affordable Care Act, that is the one thing they know. If they ever got rid of that, it would be political suicide, because that was just the worst idea. Pre-existing conditions, just awful idea. Another big difference is that German, like I had mentioned before, your German insurance company, your insurance plan works anywhere in the country. You don't have this whole network bullshit like in the US. So in the US, you have your insurance provider and they have their network, which means that they will only cover specific hospitals or specific doctors or whatever. So if you want your insurance to pay for whatever, you have to go in those networks. And, that works fine until, for example, you have to go to the emergency room and an ambulance picks you up. They're not going to go and figure out which is the hospital that's going to be the best for your insurance. They're just going to take you to the closest one. And you may get fucked over and it'll be the one that's not in your network. Or worse, the hospital's in your network, but then that hospital has contracted doctors, and that specific doctor who saw you that day is not in your network. It is such a screwed up system. I hate that. And in Germany, you don't have that. You just go to where you want to go and your insurance pays for it. Like, it's amazing how this is what I said, that the insurance companies in the US are completely for profit, and this is how they do it. They find ways to just not pay for it. While in the German insurance companies is that you pay for it, period, done. That's it. Obviously for like elective surgeries, they're not necessarily going to pay for it, but anything, especially that's life related, like cancer, for example, the idea of Breaking Bad would not work in Germany because if somebody had cancer, the insurance company would pay for it. End of discussion. So I said with Germany that they have, like private insurance companies. And by, like I said before, private meaning that this not provided by the government. There are over 100, and there are two types of plans you can buy into. There is SHI and PHI. SHI stands for Statutory Health Insurance, and PHI is Private Health Insurance. You are eligible to buy into private health insurance if you are making over 62,550 euros a year, or if you're self-employed. But once you opt into private health insurance, you cannot go back into statutory health insurance. And I say that with an asterisk because yes, there are ways to get back into like the statutory health insurance. It's not impossible. It is harder. So if you make under 62,550 euros a year, you have to pay into statutory, which is the socialized healthcare. That's what we would perceive as socialized healthcare, because everybody is paying into a sickness fund or a Krankenkasse that is then distributed to whoever needs it. If both you and your partner or your spouse are in the SHI, the statutory health insurance, your children are free, or they're covered by the government, so to speak. And you do pay a monthly fee, and it is capped at about 840 euros, but you don't pay the full 840 euros. In fact, you pay half and your employer pays half, the other half. However, if one of your partners, like with my husband and I pay into SHI, my husband pays into PHI. When we have children, our children have to be in PHI. And that is, I think, a way that they're trying to like offload the burden of the system onto people with PHI. And it is very expensive because there's no like family deal. It is, like full price for every mouth breather on the plan. So even though like this is, the SHI is, it's all about a fund, like the way it is run like a socialized system, because the overall thinking of the German people is that healthcare is a right. Everybody deserves it. Everybody helps pay for everybody. Going back to the big difference between the private, the health insurance companies in Germany versus the one in the US is profit. The ones in the US are for profit. As you can see by all these little stupid caveats that they come up with, they make it their goal to not pay, which is stupid because that is the whole reason why they're there. Like, I don't understand why we're keeping them. We just need to get rid of them. Start over. But in Germany, they are run practically like charities. They are not for profit. They are so heavily regulated and by the government. That's how they know who they can turn away, which is nobody, or what they can cover, almost everything, within reason, of course, as well as what they can charge. Now, of course, having all these companies, plays into the model of capitalism, and it does help drive down the cost, which is why it is beneficial to have all these companies, because then, if you just have, I don't know how a socialized, like the NHS, how, what drives the price up or down, but that is part of the reason why the companies in Germany are the way they are is to help with competition keep the prices down. It is still expensive, don't get me wrong, but it's that is the intention. Now, with PHI, everybody pays into what's called an at-risk premium. So it is more, more expensive. Though, of course, that is also capped because it does become more expensive as the person gets older. And like I said, it has to get capped because imagine going into retirement and having to pay up the wazoo in insurance premiums. So as you can see, overall, I think the German system works really well. Like I said, it's very similar to what the American system is, but there are a lot of aspects of it that work better. However, of course, nothing is perfect. There are some cons in the German system. One of them being bureaucracy, which I think, according to some studies, Americans have also complained that bureaucracy is a big problem. But with Germany, it is the reason why it is considered not as efficient as other healthcare systems in Europe. I have seen some people say, Germany is the best. It's better than Italy and Spain. Not according to the World Health Organization. It is not considered as efficient. Bureaucracy is actually the big problem. And I did actually see a news report on it. I'll have to see if I can find it. If I do, I will link it below, where they did talk about one of the big strains, especially with COVID-19, that is putting on the German healthcare system, is showing that how bureaucracy is slowing a lot of their processes down, where especially with something with COVID-19, you need every second, as well as the idea that Germany is very far behind in terms of digitalization, and that also hampers a lot of their efficiency. That's another topic for another day. But those are aspects, those are some cons in the German healthcare system, though when you compare it to the dumpster fire that is the American healthcare system, it's However, one of the things we did actually that we have experienced recently is how if you have private health insurance, you are kind of treated like royalty compared to if you have statutory health insurance. And like I said, this happened recently. So back in February, my mother-in-law has been having problems with her blood pressure. It has been kind of fluctuating. It was rather low. If you saw my video on one of my COVID diaries, you'll know what I'm talking about. But she has her specialist that she's been going to for a number of years because she has had surgery back, I think, in 2007. I believe it was before my husband and I met. So I'm making up the year. I'm not entirely sure when this happened, but it was before we met. She wanted to go to her specialist, but her specialist was on vacation. So she had to wait a week. In the meantime, she ended up going to the hospital. She had to go. I think she even went to our general practitioner, our Hausarzt, to see what she can do, just at least bide her time until she was able to get a hold of her specialist. So when she finally did, this was in February, mind you, her specialist told her that she wasn't going to be able to get an appointment until May. And she was like, well, what do I do if I have this problem again? And the response, go to the hospital. On the other hand, with my husband who has PHI, if he had called, he would have gotten an appointment within a few days. And that's because doctors and healthcare providers, healthcare providers in general, not just doctors, all of them as a whole, they receive about 3 times more money from PHI patients than they do from SHI. So that's why they're usually very willing to roll out the red carpet when a PHI patient calls and asks for an appointment, which is really annoying. But it is very much still a pay-to-play system because it is what it is. So that is the big difference. I hope I covered everything. I'm sure I missed something. And if there are any aspects of the German healthcare or the American healthcare, please let me know. Let me know in the comments below. Tune in next week because I do plan on talking and giving my hot take on why Americans want to keep, I don't want to say they want to keep our current healthcare system, but why they have been hesitant to go towards a more socialized healthcare system. I think that's a better way of putting it. So definitely tune in next week for that. I will try to set up a reminder somewhere, but same time as every Monday. So thank you for joining. I really hope that learning the two, this kind of, my very rambly style, I hope you enjoyed it. If you did, please consider subscribing and give this video a thumbs up because it lets me and YouTube know you like content like this and you want to see more. If you have any questions, comments, or topics you'd like to see on this channel, or like I said, anything else to help expand learning the differences between American and German healthcare system, please let me know in the comments below. The God Queen is available in both ebook and paperback. I have all the links for this book business in the description below. And don't forget to connect with me on social media, whether it is through Instagram, Twitter, or Facebook. And that's it for today. Until next time. Ade!